Hi all, welcome to the new video. It was on this day, May 27th, was the beginning of emergency medicine. And it was started in Europe, in London especially saying, by the European Society for Emergency Medicine, EUSEM. Actually, I'm here to tell something about emergency medicine, what we usually see in India. That's why I thought I'll take a video on this. Okay. As everyone knows, emergency medicine, emergency, it is the urgency or the acute illnesses, the acute incidents happening is what emergency, not a chronic thing what is started long back and you're coming for emergency. That is not emergency medicine. So emergency medicine is an independent, it was earlier before 1960 or 1970, it was the physicians or the anesthetics who looks after the emergency department. Now we have an MD for emergency medicine. We have different courses for emergency medicine. Not even doctors, there are many professionals, other professionals also in emergency medicine department to look after the emergency medicine, ER department. So what is emergency medicine? What is actually in the hospital in the emergency medicine department? It is not each and everything you're showing to the emergency medicine department. As I consider, I have worked for 3 to 4 years in the casualty. What we see in our places is like, for each and everything they come to emergency medicine. So what happens there? The quality or the time assurance for an emergency patient comes, it affects them. For a fever or a cough, see, anything can be emergency. Even fever can be emergency at times, but not like a fever we started 3 days back. It is stable, the patient is stable, and they come into casualty because they don't get an OP from the other departments. That concept is wrong. Emergency medicine is actually for the acute illnesses, an accident, a sudden attack, sudden respiratory difficulty, sudden difficulty in breathing happens suddenly, an obstruction in the urine, sudden. It's like acute illnesses. Acute illness, acute means that all of a sudden, not a chronic, not which happened 3 months earlier we started, or which started 1 week back and suddenly, okay, which the disease is started 1 week back, suddenly it can have a aggression. It can aggressively aggregate suddenly. That is also emergency. Okay, fine. But what we see in our places, emergency medicine has to give. Emergency medicine means emergency medicine, acute illnesses or acute anything, accidents have taken place. Emergency condition it is. Not like each and everything is coming and for each and everything, for a cough since 1 month, they are coming to casualty. That is not a thing where the place to treat a patient, emergency medicine department. What we see in our place, our locality, our native place, each and everything come to casualty so that can deviate and go easily to the OP. To deviate the OP, to have a bridge, you can say cross bridge, like a bypass, they'll come to casualty to easily go to the OP, so that the doctor in the casualty will call and tell, okay, this person has come to the casualty, kindly refer. That is not the place actually. Emergency medicine is a place not as a reference point. It is a place where we get acute emergency, acute medications. For example, we get accident cases. Our department, the emergency department, the job is to stabilize the patient first. Whether it's an acute attack, a stroke patient, the emergency medicine is that acute thing where the patient is going to, when a patient is collapsing, there is no pulse, like BLS, ACLS, all those things comes in emergency medicine. So emergency medicine is to stabilize the patient and then hand over to the other department, medicine or surgery, whatever it is. So investigations can be anything, CT, MRI. MRI is not like it takes time. So CT scan, ABG, arterial blood gas can be taken. So these things, UST abdomen, emergency condition, also X-ray. These all things comes in emergency medicine also. Suddenly, we have to decide something to give. Intubation can be done if the patient is not it's going to a critical stage. You can intubate the patient. BLS, basic life support, advanced cardiac life support. This all comes in emergency medicine department mainly. So emergency medicine department, the best country what I have read is that Japan is the best country where we have emergency services very reliable and it is very good, it seems. Japan is the best country in regard to the emergency medicine department, emergency medicine services. Okay. So emergency medicine department, there are a lot of MDs now as a part of emergency medicine all over the world. It has been a great success. Like after 1970s, a lot of courses have been under emergency medicine department. Earlier in our India now, after 2000, it is being common. After 2010, I can say it is more common nowadays. MDs are more people are doing MD in emergency medicine. They have a good scope. Even any other course, emergency medicine, they take a course in emergency medicine in India, they go abroad. Even some of our friends have done that. They're working good in the timings are different. Yeah, of course, there are day and night and all, but those that 6 hours or 8 hours, that is a crucial thing. They are very active. They're really alert what to do, how to stabilize a patient, how to rescue a patient. So that is the main thing, emergency medicine. So that much importance emergency medicine have. The beginning of emergency medicine was the day on May 27th. It was brought about by European Society for Emergency Medicine, EUSCM, in London. It was in Europe, you can say. That's the European Society. So it was an independent thing what earlier it was, but now we have a separate department, separate team, separate staff who are well trained in this emergency medicine, what to do, how to stabilize the patient, how to hand over the patient without any problems. That is the emergency medicine. So I thought I'll share a video because what I come across in my locality or my place is like emergency medicine is a thing what we have a bypass to go to the OP. It's not the thing, and each and every investigation has not to be done by the emergency medicine department. It is an acute thing, not a chronic. Okay, accident case to stabilize. If you want X-ray, suddenly take an X-ray. CT or CT, suddenly CT. Intubate the patient. What happens in casualty in our India most of the times? The patient comes there, wait. An accident case will take from morning, sometimes till evening. It will take. By the time the patient with the pain, he cannot survive the pain. Pain relief has to be given immediately, and make sure the patient does not have any allergy or anything. Chest pain, take an ECG and rule out. Okay, if you have a repeated chest pain, repeat the ECG or send for a tropi. Then you call the concerned staff. The casualty RMO, the CMO can do all those things. Why can't it be done? So our emergency medicine department, the people also, they cannot wait for 5-10 minutes, and that too, it's not an emergency condition. The emergency medicine, the acute illnesses patients have been suffering because of the other people. Especially in Sundays, which is horrible in the casualty in our localities and all. Sunday, because there is no OP at all, everyone comes to the casualty for each and everything. Obviously, there is a stress, there is a tension when our child is having a fever or it is there. But emergency medicine, the priority is for emergency medicine. Still, the doctors are seeing other patients, and even the infants are there. Infants can be there. A gynec patient can come. So everything has a facility. Gynec the obstetrics can be shifted to LT. The sisters are there, can call. The gynec doctors will be coming on time. They have on call duties. So each and everything doesn't mean to come to obviously the term the term obstetrics like term period. You have to consider it. They are the first priority. You have to look them and immediately shift to LT and call the concerned doctor. That is over there. We don't need to go because our duty is to stabilize the patient, to hand over the correct authority after stabilizing without having any problems. Okay, that is our thing, concern. Our means emergency medicine. In regard of emergency medicine, I'm talking. Right now, I'm in physiology. I have worked in a casualty center for 3 to 4 years. Around nearly 4 years, I have worked in different places. But right now, I'm in physiology. I took MD in physiology. I'm working in physiology. But what I experienced, what I'm telling you. So what happens here usually is that this is the problem what we face. And bystanders come upon us, and you can see many incidents happen recently when stabbing a doctor. So these things happen. That's the thing what in casualty we face. In other countries, emergency medicine department thing means emergency medicine. This emergency thing is only happening. Here it is like something else is happening. Okay, so it's a team of a doctor, nurses, everyone is a teamwork there. Okay, so single-handedly you cannot do BLS or ACLS for long. We need a group of team. ACLS means 6 to 7 members are there. One will be a timekeeper, one will be a resuscitator, one will be giving the respiratory breathing. Breathing and resuscitator. They can interchange 2 of them. One can be in the defibrillator. One can be the team leader. He has to give advice. One is the nurse. So it's a team of work. So not only single-handed doctor has to handle, it's a team of work. Nurse has its importance, doctor has its importance. So word emergency medicine, the emergency medicine means it's a team of professionals. Okay. So I just thought I'll share to you. That's all. That's it. Okay. Thank you.